he'll be allowed to give his opening statement, but we want to move, and so we're just going to start. Okay. I appreciate everyone's work on these pro-family, pro-patient bills. When the committee puts politics aside and we work together, we deliver results for the American families. As chairman of the Health Committee, I'm committed to holding more markups to move forward your priorities, our down-dais priorities, to pass them into law to the benefit of folks in Louisiana, in your state, and all Americans. The legislation we're considering today is, I think, contributing to families' health. There's Senators Capito and Smith's Women and Lung Cancer Research and Preventive Services Act, helping doctors better identify which patients are at risk for lung cancer. Despite smoking at lower rates than men, more American women die from lung cancer than other types of cancer, which I found surprising. As a doc, I would have thought something like breast, but now it's lung, which is remarkable. I thank Senators Capito and Smith, as well as Secretary Rubio, who championed this legislation as a senator. And again, as a physician, I know early intervention can save lives. Senators Banks and Padillas, Tyler's Law enhances healthcare providers' ability to detect fentanyl exposure. The bill honors Tyler, a 19-year-old who died from fentanyl poisoning the day after being seen in an ER. Unfortunately, the common drug test doctors gave Tyler was not able to detect synthetic opioids such as fentanyl. Too many families know the pain from losing a loved one to fentanyl. I was happy to collaborate with President Trump to protect Americans from this dangerous drug. In July, President Trump signed my Halt Fentanyl Act, supporting law enforcement as they fight the scourge of fentanyl and fentanyl-related substances on our streets. In December, President Trump signed our Support Reauthorization Act into law, which bolsters prevention, treatment, and recovery for Americans with substance use disorders and mental illness. I'm grateful to colleagues for the continued work to address the opioid crisis. Senators Hawley and Hassan's Rural Hospital Cybersecurity Enhancement Act empowers rural hospitals to bolster their cybersecurity and protect patient data. Cyber attacks on the healthcare sector not only put patients' sensitive health data at risk, but can delay life-saving care. In conjunction with the bill we're voting on today, I'm also working with Senators Hassan, Cornyn, and Warner on the Healthcare Cybersecurity and Resilience Act to better prepare the healthcare sector against cyber attacks. I look forward to working with Ranking Member Sanders to advance that bill later. Senators Hoeven and Peters Protect Infant Formula from Contamination Act enacts important protocols ensuring that infant formula is safe and readily available. We cannot allow a repeat of the 2022 infant formula shortage, which had mothers scrounging the shelves at Walmart finding formula for their babies. This legislation increases testing on infant formula for potential contaminants so the Food and Drug Administration can work better with manufacturers to address safety concerns before infant formula reaches the shelves. The bill also directs FDA to provide additional reports to Congress on how it's working to improve the safety and supply of infant formula. Thank you for all your work. I look forward to advancing these bills as part of a pro-family, pro-patient agenda. And with that, I recognize Senator Sanders.
Thank you. This morning we'll be considering 4 bipartisan health care bills. Our first bill is the Women Lung Cancer Research and Preventive Services Act. This bill addresses the reality that lung cancer is a very serious problem for women in this country, and it begins to address that issue. The second bill is S-921, Tyler's Law. At a time when we are in the midst of a major opioid and substance abuse epidemic in America, this bill improves the ability of healthcare providers to diagnose and detect fentanyl use in their patients. Third bill is the Rural Hospital Cybersecurity Enhancement Act. Rural hospitals are increasingly the target of cyber attacks that threaten patient safety, and many lack the staff to defend their networks. This bill takes us a step forward to help train staff. Fourth bill is the Protect Infant Formula from Contamination Act. As we all recall, just a few years ago, we faced a massive shortage of infant formula after the largest manufacturer of infant formula had to close down its plant in Michigan after 2 infants died from bacterial infections. We've got to make sure that doesn't happen again. This bill requires companies that manufacture infant formula to report any positive test of contaminants in their plants and a report from FDA on their strategy to keep infant formula safe. I am supportive of all of these bills and would ask my colleagues to vote yes on them.
We'll now begin consideration of 4 bipartisan bills. S. 1157, the Women in Lung Cancer Research and Preventive Services Act of 2025. S. 921, Tyler's Law. S. 2169, the Rural Hospital Cybersecurity Enhancement Act. And S. 272, the Protect Infant Formula Act from Contamination Act. For the awareness of all senators and staff, we intend to vote on amendments as they are raised, but we'll hold the vote on final passage of both bills until the end of the session. We'll keep members and staff updated on the timing of the vote on final passage. In the interest of time, I ask colleagues to hold any remarks on today's bills until after we vote, but I will stay until you've had a chance to speak. As a reminder, when discussing an amendment, please identify which amendment you are discussing by its name and its number. Anybody have an amendment?
No. Call them up one by one.
We'll now begin with consideration of S. 1157, Women in Lung Cancer Research Preventive Services Act of 2025. We have a manager's amendment to S. 1157. I move to adopt the manager's amendment in the nature of a substitute and to have it be considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. All those opposed, say nay. The ayes have it. The motion is agreed to. I thank Senator Capito as well as our co-lead, Senator Smith, for their leadership to improve lung cancer care for women. Again, acknowledge Senator Marco Rubio, now Secretary of State, who championed this during his 4 previous Congresses. This bipartisan legislation helps doctors better identify which patients are at risk for lung cancer and refer them for screening. It will save lives, save patients, money, stress, you name it, by detecting and treating lung cancer early. Seeing no other amendments, we'll now move to the next bill. We begin with consideration of S. 921, Tyler's Law. We have a manager's amendment to S. 921. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. Those opposed, say no. The ayes have it. The motion is agreed to. I thank Senator Banks and his co-lead, Senator Padilla, for their leadership. This honors the memory of Tyler Shamish, who died from a fentanyl poisoning the day after he was admitted to the emergency room. It continues President Trump and ours collaboration. He signed the Support for Patients and Communities Act reauthorization into law. I look forward to advancing this bill, which will add to our committee's legacy of this bipartisan legislation to address the opioid crisis. Seeing no amendments, we'll move to the next bill. We now begin with consideration of S. 2169, the Rural Hospital Cybersecurity Act. We have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. Opposed, say nay. The ayes have it. The motion is agreed to. I thank Senators Hawley and Hassan for their work on this legislation to improve cybersecurity for rural hospitals. It's a continuing challenge for the healthcare sector, particularly for rural hospitals. And this gives those hospitals resources developed specifically to develop the cybersecurity needs of their communities. I will vote yes on this. Seeing no other amendments, we'll move to the next bill. This will be consideration of S. 272, the Protect Infant Formula from Contamination Act. We have a manager's amendment to S. 272. I move to adopt in the nature of a substitute and have it considered original text for the purposes of further amendments. All in favor, please say aye. Aye. Opposed, say nay. The ayes have it. The motion is agreed to. I want to thank Senators Hoeven and Peters for their work on this legislation to ensure that our infant formula remains safe. I'd also like to thank Senator Collins for her support of this bill and for helping to shepherd this bill through our committee. Maintaining visibility into the safety of infant formula is essential to protect families and ensure we do not have another infant formula shortage like in 2022. I will vote yes on this bill. We'll now proceed to any amendments. Are there any senators wishing to offer amendments?
Mr. Chair.
Senator Kane.
Mr. Chair, I have a very technical amendment. This is a great bill. Really glad we're doing it. And here's an education about Senate rules that I didn't know after 13 years here. A manager's amendment is not able to change the short title of the bill. And so in the amendment, some things changed, all agreed upon. And so my amendment is now to change the short title of the bill so it conforms with the manager's amendment. It's an agreed upon issue, a very technical one. And so this is Kane Amendment 1 to S272. If you're really a nerd about this and want to know, if you look at the original title, it talks about testing of formula for microorganisms and toxic elements. The manager's amendment focused upon microorganisms, does not require testing on toxic elements. And so this is just an amendment of the title to match the manager's amendment text. And I would ask for a voice vote on it.
All those in favor, say aye.
Aye.
Those opposed? The ayes have it. The amendment passes.
We have to do a recorded vote.
Well, we have to do a recorded vote, I'm told. Okay? So,
No, we can do a voice vote.
we're good. Okay, great. Thank you, Senator Kane. Let's keep rolling. So, what do we do now? This concludes consideration of amendments to S272. We'll now move to vote on the final passage of S1157. As amended.
And that needs a recorded.
I move to favorably report S1157 as amended. The clerk will call the roll.
Senator Paul?
No, that was the manager's amendment, so just keep going.
Okay. Senator Collins?
Aye.
Senator Murkowski?
Keep going.
Okay. Senator Mullen?
Keep going.
Senator Marshall? Senator Scott? Senator Hawley? Senator Tuberville? Senator Banks? Senator Houston? Senator Moody? Senator Sanders? Senator Murray? Senator Baldwin? Senator Murphy? Senator Kane?
Aye.
Senator Hassan? Senator Hickenlooper? Senator Markey?
That was on the amendment.
Senator Kim?
Maybe don't do random.
Senator Blunt Rochester? Senator Alsobrooks? Chairman Cassidy?
Aye. I don't have a proxy on Paul,
Okay.
but I have a proxy on Murkowski and Mullen.
Yep.
And that would be ayes.
Okay. So Senator Murkowski, aye. Senator Mullen, aye.
And just Senator Scott, too.
And Senator Scott,
And Senator Scott. Senator Scott, aye.
correct.
So I have 21 ayes, no nays.
Motion's agreed to.
Oh, sorry, 22 ayes, no nays.
Okay, where am I?
Yep.
Oh, this is you.
Oh.
Yeah, Paul's the only one.
The ayes have it, the bill is agreed to and will be favorably reported as amended. We'll now move to final passage of S921 as amended. I move to favorably report S921 as amended. The clerk shall call the roll.
Senator Paul? Senator Collins?
Aye.
Senator Murkowski?
Aye by proxy.
Senator Mullen?
Aye by proxy.
Senator Marshall? Senator Scott?
Aye by proxy.
Senator Hawley? Senator Tuberville? Senator Banks? Senator Houston? Senator Moody? Senator Sanders? Senator Murray? Senator Baldwin? Senator Murphy? Senator Kane? Senator Hassan? Senator Hickenlooper?
Aye by proxy.
Senator Markey?
Aye by proxy.
Senator Kim?
Aye by proxy.
Senator Blunt Rochester?
Aye by proxy.
Senator Alsobrooks?
Aye by proxy.
Chairman Cassidy?
Aye.
I have 22 ayes, 0 nays.
The ayes have it. The bill is agreed to and will be favorably reported. We now move to the final passage of S2169 as amended. I move to favorably report S2169 as amended. The clerk shall call the roll.
Senator Paul, Senator Collins,
Aye.
Senator Murkowski,
Aye by proxy.
Senator Mullen,
Aye by proxy.
Senator Marshall, Senator Scott,
Aye by proxy.
Senator Hawley, Senator Tuberville, Senator Banks, Senator Houston, Senator Moody, Senator Sanders, Senator Murray,
Aye by proxy.
Senator Baldwin, Senator Murphy, Senator Kane, Senator Hassan, Senator Hickenlooper, Senator Markey,
Aye by proxy.
Senator Kim,
Aye by proxy.
Senator Blunt Rochester,
By proxy.
Senator Alsobrooks,
Aye by proxy.
Chairman Cassidy.
Aye.
I have 22 ayes, 0 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amended. We now move to final passage of S-272 as amended. I move to favorably report S-272 as amended. The clerk shall call the roll.
Senator Paul, Senator Collins, Senator Murkowski,
Aye by proxy.
Senator Mullen,
Aye by proxy.
Senator Marshall, Senator Scott,
Aye by proxy.
Senator Hawley, Senator Tuberville, Senator Banks, Senator Houston, Senator Moody, Senator Sanders, Senator Murray,
Aye by proxy.
Senator Baldwin,
At the end, yeah.
Senator Murphy, Senator Kane, Senator Hassan, Senator Hickenlooper, Senator Markey,
Aye by proxy.
Senator Kim,
Aye by proxy.
Senator Blunt Rochester,
Proxy.
Senator Alsobrooks, Chairman Cassidy.
Aye.
I have 22 ayes, 0 nays.
Senator Hickenlooper, would you want to be recorded as present for the previous votes?
Okay.
Okay.
Hickenlooper.
I now move to authorize staff to make any required technical and conforming changes when preparing S-1157, S-921, S-2169, and S-272. All in favor say aye. Aye. All opposed say nay. The ayes have it. The motion is agreed to. That concludes the voting. Is there any? We did all four, right?
4?
Did we do all 4?
Yeah.
Yeah, I had all four. Yeah.
3, 4.
Yeah. Is there any senator who wishes to speak on today's bills? Senator Banks, do you have a statement to make? Well, the committee stands adjourned. Thank you all.